This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
What is asthma? Asthma is a respiratory condition marked by spasms in the bronchi of the lungs, causing difficulty in breathing. It usually results from an allergic reaction or other forms of hypersensitivity. What are these related to? Asthma is also related to heartburns. For heartburn, also cause asthma chronic obstructive pulmonary disease, also known as COPD. What are these effects and how common is the disease? Asthma is a chronic disease that affects the airways that carry oxygen in and out of the lungs. If a person has asthma, the inside of these airways is irritated and swollen. Asthma can cause shortness of breath, wheezing, coughing, and tightness in the chest. In the Philippines, asthma affects over 6 million children. The Philippines is ranked 32nd in self-reported asthma. The country has prevalence rate at about 12%. How is the disease inherited and can it be tested? Asthma can be inherited. Asthma is not contagious. While its causes are still unknown, researchers have determined that asthma can be caused by both hereditary or inherited and environmental factors. Just because you have a parent with asthma or an allergy doesn't mean you'll have it too. But you might inherit the tendency to develop asthma. How is the disease diagnosed? To diagnose asthma, your doctor will discuss your medical history with you and perform a physical exam. You may need a lung function test or maybe other tests, such as a chest or sinus x-ray. If you and your child are having problems breathing on a regular basis, don't wait, visit the doctor immediately. Is there treatments available? There are a lot of treatments and medications to actually cure asthma. Doctors advise you to always regulate your activities and to also build strength. A type of medication used to treat asthma is a long-term control medication, such as inhaled corticosteroids, are the most important medication used to keep asthma under control. These preventative medications treat the airway inflammation that leads to asthma symptoms. Say today's asthma treatments are so effective, many people have near complete control of their symptoms. There's no cure for asthma, however, it's a highly treatable disease. In fact, some doctors say today's asthma treatments are so effective, many people have near complete control of their symptoms. There are lots of research for a more profound way of treating asthma, and our doctors and scientists are trying to do their best to come up with a better solution.
Oh my god, it's so much fun.
Yeah, I was screaming like, Papi!
You like him?
Yeah, of course! You don't like him?
I like the other member of the group. Don't mention it. Sorry, I have to go, okay? Bye, see you around.
Pneumonia is an infection of both lungs, and the cause of it are bacteria, viruses, and fungi. The infection can cause inflammation in the air sacs in the lungs, which are called alveoli. The alveoli will be filled with fluid or pus, making it difficult to breathe. Pneumonia can be inherited by viruses and bacteria that are commonly found in the nose and the throats of people, and can be infected. It can infect the lungs if they are inhaled. They may also spread via airborne droplets from cough or sneeze. In addition, pneumonia may spread through blood, especially during and shortly after birth. There are related diseases such as asthma, heart disease, and chronic obstructive pulmonary disease or COPD. And according to the researchers, about 15% of the deaths of the children under 5 years old, killing about 800,000 children in 2017. But pneumonia can be prevented by nutrition and immunization. Streptococcus pneumoniae is the most common cause of bacterial pneumonia in children, while Haemophilus influenzae type B is the second most viral cause of pneumonia.
Hi Doc, can I ask you a question?
Sure, what is it?
Do you have at least generic test for pneumonia?
Yes, we have. We use chest X-ray to look for any inflammation in the person's lungs.
How many days can my daughter recover?
Usually, it takes around 3 to 5 days with the help of antibiotics to cure around your daughter.
Thank you so much, Doc. If my daughter is already discharged, is there any possible attacks of the disease? What we will do if it happens?
If she suddenly felt the shortness of breath, try to send her to the hospital immediately or give her the prescribed antibiotics. No problem, ma'am. It's my job to serve.
Okay class, we're gonna learn about tuberculosis today. Tuberculosis is also known as TB. TB or tuberculosis is a contagious disease that infects our lungs and also attacks our spine and brain. Tuberculosis is also accompanied by cough, fever, and weight loss. TB bacteria grows in the lungs and can cause chest pain, coughing of blood, fatigue, and others. Now class, can you share anything about what you have researched?
From what I've researched so far about tuberculosis is that a person with tuberculosis can infect others while not being treated early.
The gene expert test is a molecular test for tuberculosis that detects for the TB virus or bacteria.
The disease can be diagnosed by the doctor by examining your lymph nodes and by doing a skin test, but blood tests are becoming more common.
Okay, that's good. The treatment is a 6-month course of combination of antibiotics. And kids, did you know that TB is also one of the most deadliest diseases in the world? In 2017, there is 1.3 million people who died because of TB. It is according to WHO. But unfortunately, the prognosis in properly treated TB is good. We are advanced enough with our medications that as long as we take our medicine for as long as we are intended, we can treat ourselves and help in reducing the spread of TB. That's all.